In this video, I'm going to discuss what a rehab plan should look like after you've had Achilles surgery, according to the latest research. So we'll look at restrictive plans versus progressive plans, then also why it's really not a good idea to overstretch. Then we'll look at progression criteria. So when do you know you're ready to move on to the next stage? And then lastly, I'm going to look at every single stage in the rehab process, what exercises to do, how much weight you can put through your leg, when you may be ready to progress, and we'll discuss all of that in detail. For those of you who don't know me, my name is Maryke. I'm one of the physiotherapists from treatmyachilles.com, where you can get online physiotherapy assessment as well as treatment for your injuries. Have a look at the description of this video if you want a link to our website. The rehab plan that I discuss later in this video is classed as a more progressive rehab plan. And the reason for that is it allows for early weight bearing, so putting some weight through your leg while you're still in the boot, around about 3 weeks after surgery. And it also allows for early mobilization exercises. Now, you will still have restrictions of things you shouldn't be doing, but it allows earlier movement. So in the more restrictive programs, they used to stop people from putting any weight through the foot for the first 6 to 8 weeks. Now, why does this matter? Well, a recent literature review showed that they looked at 20 randomized control trials, and that included about 1,007 patients. And what they found was that the guys who did the early mobilization and the early weight bearing tended to have fewer complications after surgery, including fewer re-ruptures, and if they did re-rupture, it wasn't as severe. There's also some evidence to imply that perhaps people with who follows the more progressive plan can get back to sport or work activities more quickly. But before we can say that this is definitely the best plan, there is more research needed, but at the moment it seems to be the case. Now, it's really important that if your doctor has prescribed a more restrictive plan than what I'm suggesting in this video, you don't just follow what I'm saying. They may have very specific reasons why they want you to follow a more restrictive plan. There are certain cases that can benefit from that, where you've got to be a little bit more careful. So if you don't understand what's going on, ask your doctor. They will be able to explain to you why it's better to take a little bit more time in your case. Please don't overstretch your tendon. So it's really normal for the Achilles tendon to feel super stiff and uncomfortable for the first 12 or even a little bit longer weeks after you've had surgery. Now, during that period, people tend to become a little bit obsessed, and even therapists, with getting that tendon lengthened, getting the range of movement back. But there's really convincing evidence that Achilles tendons after Achilles rupture surgery have a tendency to heal in a lengthened position. And the problem with that is if the tendon's now lengthened to what it normally is, it means that your calf and Achilles complex can't work as well as before. So if it heals in that position, it means that you can't push off when you're walking, when you're running, when you're jumping, when you're going upstairs as well as before. And you can't really get that function back fully. Now, to investigate if the rehab may make a difference, a group of researchers recently looked at what if they postponed when they allow patients to do Achilles tendon stretches as well as eccentric exercises by a few weeks. So why eccentric exercises as well? Well, because eccentric exercise has actually been shown to be very effective at lengthening tissue. So that's why they also postponed that. And what they did was, traditionally, Achilles or dorsiflexion stretches would be started at around week 8 after surgery. So in this study, what they did was they asked the one group of patients to keep their feet in a more plantar flex position and never go past neutral dorsiflexion for the first 12 weeks. And then they introduced the dorsiflexion stretches and eccentric movements. For the other group, they followed the traditional plan of at 8 weeks, you start getting into dorsiflexion stretches and progress from there. Now, what the results showed was when they looked at a 12-month follow-up, which is brilliant because it shows you the long-term outcome, the guys who were in the more conservative program actually had better results, and they were less likely to have tendons that healed in a lengthened position. So this does not definitively mean that this type of program is the best, because we need more studies to replicate this and show us that yes, it is definitely the best. But it's definitely convincing evidence for me to start thinking about not forcing that dorsiflexion stretches too early. This advice has also been echoed in a consensus statement that was brought out recently. Now, I'll put the links to all these research studies in the description of this video for you. When any body part is injured, it loses some of its strength and capacity and endurance to deal with the activities you normally want to do. Now, this is where rehab comes in, because the aim of the rehab plan is to restore the strength and the endurance to the level you need. And of course, depending on your type of sport or type of activity, the level you work towards will be different. Now, to get there, you can't just jump into high level stuff. So you've got to start at a low level and then progress it over time. And the way that we know that you're likely safe to move on to the next level of rehab is we use progression criteria. So progression criteria can be time-based or function-based, and both of them are important. Time-based criteria means that your body needs a certain number of days, weeks, months to achieve a certain level of strength or to complete certain functions. So you can't really progress until that period of time has gone by, because the body just wouldn't have had time to restore to the level that you need it to. And then we've got the function criteria, which means you need to be able to have a certain level of control, a certain level of strength, be able to do specific movements to be able to safely progress to the next. So whenever we look at progressing rehab levels, we both look at, have you been doing the correct exercises for the right period of time to achieve the strength or the endurance, whatever the aim was of that rehab stage in that period of time? And then you're safe to move on. You'll notice in the program that I'm going to discuss in a minute, there will usually be both time-based and function-based criteria for you to be able to progress. Okay, so if we have to summarize what the research is showing with regards to what may be the best type of rehab plan to follow after Achilles tendon surgery, then it would be early weight bearing, but while you've got your foot in a boot and always in a level of plantar flexion for the first 12 weeks. Also, early starting mobilization exercises, but avoiding all dorsiflexion stretches for the first 12 weeks, as well as eccentric only exercises, and only starting it after the 12 weeks has passed. Now, remember, your doctor may have very specific reasons why they don't want you to follow this type of plan. So you've got to check with them what they want to do. And if you're not sure, ask them. They will explain why this is the best in your case. If we look at the first 2 to 3 weeks after surgery, what can you expect? Well, one, you will very likely have your foot in a plaster cast with your toes pointing slightly downwards. You will be given crutches, and you will be told to not put any weight through that cast at this point. You won't be able to do any ankle exercises, but you will be allowed to do some core exercises as well as things for the lower body that doesn't put strain through your cast. So examples of this, if we think of the core, you can do things like sit-ups, you can do push-ups on your knees, you can do Russian twists, you can even do side planks on your knees. So anything that doesn't put weight through that cast. Examples of leg exercises could be side leg lifts, leg curls, knee extension in sitting, or even if you're on all fours and just extending your leg back to get the glutes going. So as long as you don't put weight through your cast, it should be okay to do. 3 weeks after surgery. Now at this point, your cast will likely be removed and your foot will be placed in an orthopedic boot. They will put a few heel lifts into the boot to keep your foot at this angle. And depending on your size, it may be somewhere between 2 inches or 5 centimeters of heel lifts that they put in, but you're looking for about a 30-degree angle in that foot. Now, some of the more fancy boots these days, like the Vacoped, actually don't need any heel raises because you can adjust the boot itself with hinges to point down. You'll likely be told that you can start putting some weight through the foot, and it's usually okay to put most of your weight through it as long as it's pain-free. So the doctor's advice is usually to put weight through it as you can tolerate. Now, what you'll quickly find out is that walking in a boot is really uncomfortable because it's super high compared to other shoes and it's still pointing down as well. So something that can be useful is if you've got a shoe on the other leg that has a thick sole, like a running shoe, but then also you get something called the even up, which you can just clip onto it that lifts it a little bit higher, and that can make walking much, much more comfortable. But yes, during this period, whenever you're upright, you have to have your boot on, but you're usually allowed to put a little bit of weight through it, but check with your surgeon if that's allowed. You may also be given permission to remove your boot from time to time and start doing some ankle exercises with your foot. Now, usually they allow free active inversion and eversion, where you just move your ankle side to side, but you want to keep it in that plantar flex position that it doesn't go past the neutral dorsiflexion. So it can come up to 0 degrees, but not go past that. Then we're also thinking of free active pointing the toes down and gently pulling it up. Remember, we're not doing stretches yet for the Achilles tendon, so you're just moving it in the range where you don't really feel much of a stretch there, and definitely not past neutral degrees. But your physio and your doctor will guide you on this. You can usually also start with some isometric exercises for inversion and eversion, as well as dorsiflexion. For isometric inversion, you want to place your foot so that you're pushing against something that stops you from moving inwards. So I'm turning my foot in, but it's not actually moving because the leg of the table is stopping it. And you want to hold it for about 10 seconds and just gently push. It doesn't have to be as hard as you can. Then for eversion, you're pushing out against the resistance. So again, my foot is not moving and I'm keeping it in a slight plantar flexed position, so it's not coming up into dorsiflexion. Then if we think of isometric dorsiflexion, the best is to do it in the boot because otherwise it's going to come up past 90 degrees or past neutral. And you're holding the position for about 10 seconds or the contraction, and then you relax it. And you can do about 10 repetitions, doing it 2 or 3 times a day, but it depends on what your doctor or physio tells you is okay to do. We're not yet starting with plantar flexion isometrics at this point. Just let it rest for a little bit longer. For the rest of the body, you just continue with the exercises you started earlier, where you don't put any weight through your boot while you're doing your exercises for the legs or for your core. From between 4 to 6 weeks after surgery, your foot will now be placed in less plantar flexion, so they will start removing some of the heel raises for you, looking for about an angle of around 15 degrees, 1-5. And you still have to have the boot on whenever you place weight through your foot. With regards to the exercises, the ankle exercises stays pretty much the same. The only addition would be that you may be able to start with seated heel raises, so where you're sitting down and just gently lifting your heels up and slowly taking them back down. If your ankles feel or your Achilles tendon feels really stiff, have your feet further out in front of you to start with. And then as it loosens up, you can bring it under you a little bit more. But it's important that you don't bring them too far under you, because remember, we're not looking for a dorsiflexion stretch yet. We're only looking for dorsiflexion up to neutral degrees, so a 90-degree angle. Nothing past that yet. 6 weeks after surgery, your heel raises will be reduced even further, so that you only have about 1/2 inch or 1 centimeter under your heel. But you still have to wear your boot whenever you place any weight through your foot. With regards to exercises, it becomes a little bit more exciting that you can start strengthening the ankle into all directions using exercise bands. But remember, we're still not going past neutral degrees of dorsiflexion. So when you're doing the pulling the foot up, it only goes to neutral, and that counts for both the pulling up exercise as well as the one where you push against resistance and release it. You don't go past that neutral yet. Concentrate on doing these as slowly as you can. Why that way? Because you force your body to control the movement better, and exercises of that type has been shown to really help the brain connect to the injured body part again. So whilst you can't do anything more exciting, really make your body move in the way you want it to move and not just do its own thing, so that you gain more benefit from it. Let's look at how these directions look, or the exercises look, in practice for each direction.
For dorsiflexion, you tie the band at the front or in front of you. It works well to put it through a door, that it's stuck in the door, that it doesn't come off. And you slowly pull back only to neutral, pause for a moment, and then release it slowly back down. If you find that the band slides off your foot, you can put a shoe on your foot and see if that helps to tie it through it. Then for plantar flexion, you're holding on to the band and you're pushing away from yourself. You'll notice I've put a yoga block under my calf. That's so that my heel can be free from the floor, that it doesn't slide on it, and it makes it easier to move. But remember, we are not pulling all the way back. You have to stop at neutral, because this is not a stretch. This is to strengthen the muscles that push your toes down. So you're slowly pushing down and releasing back to neutral. Then E version, band is pulling your foot inwards, you're resisting it, pushing your foot out. This is not a large movement. You'll find that, my ankle doesn't want to move much. That's absolutely normal. Now, I'll show you this from the side on as well, that you can see what the movement is that I'm doing. But just make sure you don't have the slack on the band when you go back. It's got to be taut all the way through. And you pause when you're out and you slowly release in. Now, this is inversion. You're pulling, the band's trying to pull your foot out, you're pulling in against it. And remember, we're keeping the foot in plantar flexion, so you're not bringing it all the way around so it goes up into dorsiflexion, you're stopping in plantar flexion.
During week 7, you can usually reduce the heel raises even further, that you only have about a 1/4 inch or 1/2 centimeter under the heel. The exercises at this point stays exactly the same. Round about week 8 after surgery, up until week 12, you'll be allowed to start transitioning into regular shoes. Now, at this point, remember, we said we still want to avoid dorsiflexion range of motion past neutral up until 12 weeks. So it's important to have shoes that has a little bit of a heel on them. Regular running shoes with around a 10 to 12 millimeter heel to toe drop works well. Plus, place a heel raise insert inside the shoe, so that we're getting back to about that 1.5 centimeter lift that we had previously up to here in the boot. You'll find when you first come out of the boot that your body is totally out of kilter, and it's really difficult to actually get your balance with it properly. So it can be useful to use a crutch or a stick to just help you stabilize. And when you're walking, think about trying to have a normal pattern. Don't try and give large steps or try and walk fast. Go slow, but think about just gently putting the back of the foot down first. It doesn't have to be proper heel and lifted up. Just the back of the foot kind of touches first, and try to roll over it like a normal walking pattern. But your physio will teach you that if you're struggling with that. Exercise number 1 at this stage is just getting used to putting equal weight through your body. You'll be so surprised that for the last 8 weeks, your body's been there because this leg has been higher and not quite right and injured. Now suddenly you're asking it to be there, but it still thinks your midpoint is there. So it can be really hard to teach it to be back in the middle. And if you look at yourself in a mirror while you're doing this, it may sometimes even feel as if you want to lose balance when you go over that way, as if it's too far. So something that can be really useful is have a chair or a kitchen counter or something that's really sturdy in front of you while you correct your balance, that you just make sure you're standing on your 2 feet and you feel, what am I feeling in my feet? How much weight am I putting on each one? That you just get used to being in the middle. Doing it in front of a mirror can really help to get that visual feedback and just teach your mind again, no, I know you feel this is the middle, but this is actually the middle. So give it that feedback. And then whenever you're standing anywhere, ask your family members and your friends to tell you if they see you leaning to one side and not standing on both feet. You will very likely also be told that you're okay to start some standing calf raise exercises. Now these will be done on both feet, always wearing your shoes at this point, and nice and slow and controlled. You'll start with the heel raises with most of your weight on your uninjured leg. So 75% of your weight on your uninjured leg, 25% on the operated leg. And the first time you do them, your first goal is to do 10 repetitions slowly up and down, and you don't start with that immediately. You just do what you can do comfortably, and you build up to 10 repetitions, and you want to build up to being able to do those 10 repetitions up to 5 times in a day. Once you tick that box, and yeah, that's easy, you feel good in control and your Achilles is happy with it, then your next goal is to slowly build the number of repetitions until you can do 25 repetitions up to 5 times in that day. When you tick that box, it's time to place more weight through that leg. So then you move over so that you now have equal weight on both legs, which means 50% of your body weight on your operated side. Again, you start with slightly fewer repetitions, but build up to where you're comfortably able to do 25 repetitions, slow up and down, 5 times in your day. When you tick that box, it's time to place even more weight on your operated side so that it now is taking about 75% of your body weight. And again, build up to 5 sets of 25 repetitions throughout the day. Now, if you achieve that before 12 weeks post-surgery has come up, then you just stay on that and you continue with 5 sets of 25 repetitions. You do not increase any weight or difficulty or anything like that. But if 12 weeks have already passed and you then achieve this goal, then your physio will immediately move you onto a more taxing exercise. It's also important to remember that these targets are for people who want to get back to sport. So quite sporty people and active people in general. If you're not that fit or not that active in general, your targets may be different. It may be lower targets we're looking to achieve for you. So your targets will depend on what you want to be doing. You may also be told that you can start with light weight bearing exercises in sitting. So calf raises while you're sitting down with a light weight on your thigh. And especially for this one, control it very slowly and really focus on the slow downwards movement. Remember, don't bring your heel too far back that you end up going into dorsiflexion stretching. We're looking to do this as a strength exercise, not a stretch at this point. This is also a good time to start introducing balancing exercises. But like I mentioned earlier, you may find it really difficult just to stand with equal weight on both feet at this point. So don't move on to balance before you haven't actually mastered just equal weight. And when you do start with balancing exercises, things like tandem standing, where you've got the one foot in front of the other, is usually a slightly easier option to start with than just purely single leg standing. And definitely start by stabilizing yourself in a wall with your hand or just a couple of fingers, and as you get better, remove a finger or something that it just becomes a little bit more taxing. But at this point, it's not about no hands balancing on one leg on a really difficult thing. It's about getting yourself to understand, how am I placing my weight? How am I spreading it? So use as much support as you need to. As you get better with it, you'll be able to reduce the support. After 12 weeks or 3 months, you can usually start transitioning permanently into your regular shoes. Now, you can't go from having all that heel lift in your shoe to totally flat shoes within a week. You'll cause yourself trouble. So it's also a gradual progress, and it should be comfortable whatever you're walking in. So take your time, remove the heel lifts and everything slowly. Your physio will be able to help guide you with that. You may also be given the green light to go into the swimming pool. So doing your balancing exercises and walking in the swimming pool can often be quite useful because the water takes the weight away. But check with your doctor and physio and get really good instructions from them as to what they feel is appropriate and what not, but it may be an option. What I will say is, if you do exercise in the pool, they shouldn't be replacing the exercise you do outside of the pool, because we do need the weight bearing and the stimulus we get from the exercise you do outside of the pool. It's now time to also start doing some eccentric calf exercises. Why eccentrics? Well, basically because it's often too difficult to lift up and down on one foot properly with all your weight on it. So an eccentric exercise is a great way to start getting that strength through the full range. How these work is you go up on both feet, then you transfer all your weight onto the operated side, lift the other side off the floor, so you're just on one leg at this point, but you try not to lose any height in that foot while you're on it, and then you slowly lowering it down. It doesn't count if it plonks down, because it's gravity that's done the job then. You have to control it down. Also, it can be good to start these on floor level first, until you feel confident with it. And by the ways, you should be holding on. This is not a balancing exercise. You need to be able to concentrate fully on what you're doing in the exercise, and therefore you've got to be holding on. And once you're good with doing it on the floor and you feel confident with it, start doing them over the side of a step, because then you'll get the added benefit of the stretch, and we're looking to start getting your full dorsiflexion range back. Now, try to resist the urge to hang at the bottom for a long period of time. The reason for this is, if you stretch a muscle quite significantly for sustained stretch, it struggles to contract immediately afterwards. So if you then go up on your toes again and ask it to contract, you may not be able to control the movement so well because you've now stretched that muscle too much. And the aim of this exercise is to get the control back. You will get the range of motion if you allow it to go through the full range and you just pause for a second or two at the bottom. You don't need that sustained stretch. This is how eccentrics work. They're brilliant for that. Now, what you do is you try to build up to about 3 sets of 15 of those. And once you're comfortable with that, you start transitioning to seeing, can I come up on my toes all the way and slowly back down on one foot? And that's first prize. This is what you want to be doing, because this is a normal action you use in sport. You have to be able to lift up on your toes all the way and come all the way down again. Now, usually we get our patients to work up to where they can do 3 sets of 15 repetitions with about 2 minutes rest in between, going up and down on one leg. And once they've done that, they've got to start adding some extra weight through it. Now, how much weight you use, what targets you're looking to work towards, will absolutely depend on your fitness and what you're looking to get back to. For runners, we tend to advise that they slowly build up to being able to do single leg heel raises with added weight that equals 20% of their body weight. So it's their full body weight plus 20% extra that they can eventually do their heel raises with. However, do not rush this. Remember I said earlier that the body needs time to respond to exercise. It requires at least 12 weeks to build proper strength. So you shouldn't be looking to achieve 20% of the body weight extra within 12 weeks after you start these exercises. And in reality, most people take a lot longer for that, because the older you are, and your genetics can play a role, and your fitness level at the point when this happened will also impact on that. So take your time to achieve it and don't try to rush things. Using the seated calf raise machine in the gym is also a brilliant way to strengthen your calves. When you're sitting down and the knee is bent, you're working the lower portion of the calf muscles more, so the soleus muscle. When you're standing upright, working it with your knee straight, you're strengthening more the top part of the calf muscles, but a little bit of the soleus as well. If you're doing it in sitting, you can also allow your heel to drop over the side of a small step to get that added extra benefit of the dorsiflexion stretch. And again, your physio will be able to guide you with regards to what weights you're looking to work up towards, depending on your goal. If you're doing it at home, you'll find that there's a limit to how much weight you can actually put on your legs before it becomes a bit precarious and it wants to fall off. So then you may actually switch to doing them in standing with your knee bent. These can be a little bit tricky if your Achilles is still very tight, so I wouldn't start with them immediately, or they can also sometimes hurt your kneecap or your knee if you have a bit of an issue with those areas in general. If that's the case, your physio will be able to tell you what exercise to do instead, or just focus on the sitting ones or the knee straight ones instead. Okay, so up until this point, we've avoided dorsiflexion stretches because we didn't want our tendons to heal in a lengthened position. But if you want to get back to normal activity, you do need your ankle to move as far as it usually did. So we do need to start improving the dorsiflexion range now. It is absolutely safe to do both passive stretches or active stretches at this point, as long as you're sensible about them. So what we don't want to see is people going into strong stretches, like into a deep squat and just holding that position to lengthen it for a minute or 2 minutes at a time, or doing a strong knee to wall movement and again keeping it for 1 minute, 2 minutes at a time. What's better to do is shorter static stretches, but doing several repetitions and not pushing it as hard as you can. So you take the stretch to where you feel the first bit of tightness or stiffness, and you just hold it there for about 30 seconds at a time. Come out of it, move it a bit, repeat it again. But we're not talking force as hard as you can and making it move. If you want to do active stretches, it's things like doing double leg heel lifts and just dropping over the side of the step and holding in that position for a few seconds again. Now this is different from the strengthening exercises, because when you're doing it to improve the range of motion, you do hang at the bottom a bit, because we're not looking for the muscles to contract that heavily when we go up. So you can stay there for 10 seconds or so, come back up and do it slowly again through that range. So always when you do the heel raises over the step, think about, what is my goal? Am I looking for strength? Then I'm not going to hang at the bottom. If I'm looking to stretch, then I'm going to hang a little bit at the bottom. And your physio will be able to guide you with this. Plyometric exercises are also important if your sport or activity require them. So during this period, we're always asking, what is it that our patient wants to get back to doing? If you want to do a sport that involves running or hopping or jumping, you definitely need to include some plyometrics in there. Now, plyometric exercises are jumping and hopping exercises, but you only start them once you've got a good level of base strength. They are much higher load than any of the heel raises are. So if you start them too early, you can re-injure yourself. So your physio needs to guide you on this. They will have specific strength targets that they want you to reach before you start the plyometric exercises. Now, plyometrics can also be progressed. You usually start with easy ones first. That means you start with double leg ones, and you don't hop too high and you don't hop into fancy directions. You literally just start up and down. And as you get stronger, and it's more about actually your brain gets used to, how the heck do I hop, because it hasn't hopped for a while, then you can start doing higher jumps and more complex jumps, like for instance jumping onto a box and down, or perhaps even jumping from 2 feet and landing on one, or jumping up and down on one. So there are plenty of ways to progress that as well. And to an extent, your sport will decide what you do. If you think, for instance, basketball player needs to be jumping and landing into all directions. Runner needs to be doing hopping and things, but really just in straight lines. They don't need that complex movement that a footballer or a hockey player or a basketball player needs. So, but if you're just a walker, really no need to do any plyometrics. Or if you think of, I'm quite a bit older, I would never do hopping things in general life in any case. I do run, but I pretty much just jog. I don't look for high intensity running. Then plyometrics may not even be needed for you either. Your physio will make that call with regards to your general conditioning and strength, what you want to be able to do and where you are at the moment. Balancing exercises, these are important regardless of who you are, but they will also be catering towards the person in front of me. So the basic things we want somebody to be able to do, say for instance you just want to get back to walking and perhaps a bit of hiking, I would want you to be at least good at standing on one leg on a stable surface and perhaps doing things like closing your eyes while balancing. Whereas if you're a sports person, and especially if you want to get back to changing of direction sport, you've got to be able to balance on unstable surfaces. You've got to be able to balance while somebody's throwing things at you, or moving your head, or moving your arms, but always taking it from the easiest level. Nail everything while you're standing on a stable surface, then take it onto unstable surfaces and more complex things. Now, the question that everybody always wants to know is, when can I start my sport? There are definitely specific criteria boxes you've got to tick before you start that. So expect it to take at least 12 weeks from the moment that you have been told that you can transition, or that you can start with the eccentric heel raises. So if we're looking, it's a total period of 6 months before you can start it. But in some cases, it will be longer. It just depends on the situation. You should be able to walk at a brisk pace without any issues. You should be able to do your single leg heel raises over a step with extra weight on you. If you're going back to a running type sport or jumping sport, you should have completed a full plyometric program as well. And then if we think of the range of motion you need at least about 20 degrees of range of motion, but this will depend, dorsiflexion range of motion I should say, but this will depend on your specific ankle and foot as well. Always look at what the other side can do. So we're looking to be back to about 90% or 95% of what the other side can do. And I say this because some people's ankles are just naturally stiff and they don't have a lot of range of dorsiflexion to start with. So you're not trying to increase it past your own biomechanical limits. It's just going to mimic what the other side's doing. Plantar flexion, you're also looking for about 95%, nearly the same as the other side before you can start thinking about getting back to sport. But then also it's about how you get back into sport that's now important. So let's talk about that. The first thing is that you can't just join your regular training and expect to play full high-level sport. The rehab you've done up until this point would have given you a certain level of strength and endurance in your Achilles tendon. But now, getting into sport is a totally different load and quite a lot higher load. If you jog at a low, easy pace, it's a certain amount of load that goes through it. As soon as you speed up or do quick changes of direction, the forces are dramatically higher. So you can see why it is that you need to start with run-walk programs when you first start back running, that you allow the tendon to do a bit of work and then have recovery time. Also, why you've got to be really good and have your full volume of slow running activities back before you think about doing fast running activities, because otherwise you may just not have enough strength in the tendon yet. Your physio will be able to guide you with this, but usually it's best to first do run-walk programs or very slow jogging things with a lot of rest in between it. Work up to getting endurance into your tendon. So if you're a runner, be able to do your full running volume at your easy pace that you could do before you were injured. If you're a footballer, be able to do all the running stuff and the drills and things at a low level and a slow pace that you were able to do before. Then you start to speed things up a bit. But again, you don't go full out, especially if you football. You think of, okay, if I sprinted the ball at 100% effort, and I've been jogging at what I would call a 50% effort, then I've got to bridge that gap somehow and get it stronger through that over several weeks. So you'll start with accelerations of up to 60%, bring it back, 60%, bring it back. The next week you may work up to 70%, bring it back. And so you build it over time. And the same thing for the changes of direction. Slow drills taken a little bit faster until you're back fully. And then when you go back to playing your sports, it's always a good idea to only start in the second half of a match so that you do not play the full thing, because it can be so tempting if you're back and you're doing well that you just stay on the pitch. And it's important because match play is much higher load than what you would have had in training, because you just give all your effort. So take time and only play little bits before going back to full play. So what recovery times are you looking at? Well, from the moment of surgery to first getting back to sport. Now, this is not high-level sports participation or full out participation yet. It's just gentle back to sport is at least 6 months. It may be longer if you're a little bit older or you've had a more complex tear, or your genetics just mean that you're taking a bit longer with rehab. So at least 6 months before you get back to sport, but then probably another few months to get back to high-level sport. Excellent. Hope you found that useful. Let me know if you've got any questions. And remember, if you need more help with an Achilles injury, you're welcome to consult one of the team via video call. The link to their website is in the description of this video. Take care.